Good evening, my name is MBohaltean and I'm a first year Bachelor of Psychology student at Curtin University. This oral presentation is for Foundations for Professional Health Practice Unit and is based on the Stillwell case study of Wendy Jones and the subject of overweight and obesity. I will present a brief summary of Wendy's story and outline the definitions of overweight and obesity, contributing factors and implications. I will outline the interprofessional team that is involved in the diagnosis, treatment and ongoing support of patients, and conclude with a brief summary of the important points of this presentation. Wendy Jones is a 14-year-old female from the suburb of Brigstow in the United Kingdom. Wendy is 155 centimetres tall and weighs 72 kilos, which puts her body mass index, or BMI, at 30. The World Health Organization classifies a BMI of 25 and above as overweight and about a BMI of 30 and above as clinically obese. Wendy's medical history is unremarkable, with the exception of occasional complaints of recurring stomach pains and headaches. There have been 2 critical incidences involving Wendy that have resulted in her being referred to her school nurse and school guidance counsellor. Both incidences essentially revolved around issues of bullying at school and Wendy's social and emotional issues surrounding her weight. Overweight and obesity can be defined as an excess of body fat that negatively impacts on the health of the individual. The fundamental cause of overweight and obesity is essentially an imbalance between energy intake and energy expenditure. Genes, lifestyle and behaviours, emotional and psychological factors, family background and support systems, and cultural influences all contribute and interact in different ways. Overweight and obesity not only impacts on physical health, but can have devastating psychological effects, as was seen in the case of Wendy Jones. For many people, their condition affects their employment opportunities, and their fitness for work can lead to financial hardship. And last but not least is the considerable burden of cost to the healthcare system. The general practitioner is frequently the first point of contact for most people, and a good GP can function as a case manager, coordinating treatments, referring where necessary, and monitoring a patient's physical and psychological progress. The next step is often referring the patient to a nutritionist or dietitian who will analyse nutritional requirements and dietary habits. Patients are increasingly seeking psychological services to complement their weight loss program. This may involve a counselling psychologist, a program of cognitive behavioural therapy, community-based and internet-based peer support. Patients for whom all conventional treatments have failed, there is the option of last resort, and that option is bariatric surgery. To conclude the presentation, research evidence suggests that the most effective treatments are founded on a holistic, collaborative approach to patient care. Tailoring programs to patients' needs not only results in better patient outcomes, it significantly reduces unnecessary treatments and interventions and produces considerable cost saving to the patient and the healthcare system. Ongoing research and support are the final crucial elements in patient care. As research has shown, education alone is not sufficient to effect meaningful long-term change. The interprofessional team model is clearly the way of the future for healthcare. Thank you.